Hi, my name's Amanda. I'm one of the nurses on duty today. Please, can I just apologise so much for your waiting? I know you've waited for about 5 hours and I'm so sorry, I can't apologise enough. It's been absolutely manic today and we've had a few members of staff off with the flu as it's going around at the moment. Anyway, can I ask by asking if you've had something to eat? Because I bet you're absolutely starving. Yeah, because I'm starving as well, so I bet you're so hungry. Are you diabetic? Okay. Are you allergic to anything? What we're going to do is I'm going to get you a sandwich, okay? So just give me 1 minute. I'm going to get you a sandwich and then you've at least had something to eat because you've waited too long for this appointment, right? Let me just get you a sandwich. Okay, so there you go. You're definitely not allergic to anything? Fantastic. So you enjoy that sandwich. I'm going to ask you some questions while you're enjoying your food. If you want a cup of tea at any point, just say. Or a glass of water, even if you want some water, that's fine. When did you last have your blood sugar levels checked? Have you taken insulin today? When did you last take your insulin? Okay, well we'll check those again in a bit, right? Okie dokie, can we just start by confirming your full name for me? And is that Mrs. Miss? And if you don't mind me asking, you've got somebody with you at the moment. Are you happy with this person being with you for this appointment? Is that okay? Okay. And what is this person in relation to you? Okay, and if you can just confirm your full date of birth for me. And your full address, including postcode. GU. Okay, brilliant. And the last question, can you just confirm your phone number? Do you have a landline or is it just mobile? So if we start with your landline. 78 and your mobile phone number, if you can remember it. And can you repeat that back to me? Okay. So, do you want to start by just going over why you've presented here today? Have you seen your doctor about it? And have you taken any medication over the counter or as per your doctor? And when did you last take that? Any allergies to any medication? Okay, right. So, just pop you into the system. Right, okay, so let me just confirm with you some details. So can you just confirm your name and your full date of birth is correct, and your full home address, and then importantly postcode and house number? Is this your correct phone number? And that's obviously your landline. And is this your correct mobile number here? And you're happy for this person to be sat in with the consultation today? Okay, and if I could ask you a favour before we get going, I just need you to sign a consent form, which is here. So if you can just sign that for me, just on just this bit here. Thank you. Thank you. And we can now get on with some assessments. Okay, so what I'd like you to do is, if you could just take your top off for me, you can leave your undergarments on, because I just want to check your heart and I'm going to listen to your breathing. Okay? Okay, thank you for that. Right. So I know that you have got diabetes, that you presented to see your GP a couple of days ago. You was worried about having recurrent low blood sugar levels, and your insulin hasn't been altered recently. So what I'm going to do, because there's different things that can cause you to feel lightheaded, okay? So it's not just low blood sugar levels, although I appreciate that you are well versed with your diabetes. So I'm going to check your heart, I'm going to check your breathing, okay? I'm just going to do a general examination of your blood pressure and everything, pulse oximeter and everything like that, your oxygen levels. So these aren't latex gloves, by the way, they're non-latex. But I appreciate it can be concerning when you're feeling, when you've sort of previously been of good health and then suddenly you start feeling lightheaded. Okay. So you've not changed any medication recently, and you've definitely not started taking anything over the counter. Any illicit medication? Okay. And are you, just before we get going, do you get treated by a diabetes nurse? And where's she based at? Is that the local hospital? Okie dokie. So I think the most important thing we're going to start with is your blood pressure. Make sure you're still alive. So what I'd like you to do is just pop your arm out for me. So I need you to make sure that this area from here to here is completely clear of any clothing, so that I can put the blood pressure monitor over this area here. Okay? When was the last time that you had your blood pressure checked? So it's nothing to worry about. Okay. So just bob your arm out for me. Okay. good. Okay, just hold it there for me. And it's probably going to get a little bit tight now, so it just tightens up quite a lot around your arm. So if you start to feel panicky, don't worry about it. That's completely normal, okay? It will go down, I promise you. It's just a little bit uncomfortable. Okay. Okay. Right. Poltergeist activity went off on its own. I think I just must have pressed it by accident. Right, okay. So let's have a little look at that. When was the last time you had your blood pressure checked? Is there any chance of pregnancy? Okay, no. Good. Right, so the blood pressure is a little bit on the low side, which is probably better than it being too high, but that could account for you feeling a little bit sort of lightheaded, you know. Sometimes when our blood pressure reduces, it can cause lightheadedness and dizziness, and that can cause people to faint sometimes. So I'm not too concerned about it. What I would like to do is organise a 48-hour blood pressure monitor for you. That's nothing to worry about. So before you start worrying, that is nothing to worry about. It is literally something where we give you, like, it's almost a belt that goes around your waist. You have like a monitor on it, a small monitor similar to, let me show you on here. It's smaller than this, so don't panic, but it's similar to this. And it just sits on your side here like a belt, and there's literally a strap belt that goes around it. Okay, and there's different things that come up onto your heart, and it just lets us know what your heart rate is doing, what your blood pressure is doing over a 48-hour period. And what we have to do is give you a little brochure, and you have to fill in what you're doing over that 48-hour period, whether you're going to the toilet, whether you're doing whatever you're doing, all activities, because we need to look at what your blood pressure is doing in correlation to what activities you're doing, okay, because that can make a big difference. It can impact the different activities that you do, can impact on your blood pressure. So we need to know at that specific period of time what activities you're doing in relation to what your blood pressure is. So we'll get that sorted for you. Okay, what I'm going to do now is I'm going to check your just it's nothing to worry about, it doesn't hurt. All I need is your finger, and I'm going to check your blood oxygen levels. It just tells me how much oxygen is roaming around in your body, and it also tells me what your heart rate's doing, and whether there's an irregular heart rate. It tells me whether you're getting palpitations and things like that. Okay, so that's what we're going to do. Before I get going, would you like a glass of water? Let me get you that now. Okay. Okay, so there you go. I forgot to ask, I'm so sorry, I'm terrible, aren't I? There you go. Would you like also a glass of water? White wine spritzer, G&T. Okay, so we'll just wait for you to finish that. To ask, are you hungry? I didn't ask, I asked you, but I never asked. So rude of me. Okay, so all I need you to do is just I just need your finger, and just bob your finger out like this for me. Okay, this is what it looks like. It's called a pulse oximeter. Put my teeth back in. Can't talk, obviously. It's been a busy day and I can't talk. It's called a pulse oximeter. Okay, so what this does is it just sits on the end of your finger like this. Okay, I can't do it on me because I've got gloves on, but when we press it on, it will tell me then what your saturation of oxygen level is doing here, so how much oxygen is roaming around in your blood. Okay, that's really important because it tells us whether you're getting enough oxygen to all the tissues in your body, to your brain. Okay, and it also tells me what your heart rate's doing, so it'll give me a good indication whether you've got palpitations, whether you've got like a cardiac arrhythmia, those sorts of things. So it's one thing I never asked actually, which I probably should have done, but do you get palpitations? Do you ever feel like your heart's missing a beat, or it's a lot of time patients will describe the feeling like they've got trickling of water down the chest area? Okay. And have you ever been diagnosed with an arrhythmia or mitral valve problem or anything like that? Okay, right, so if you can pop your finger out like that for me. Yep. Okay, so this is telling me that there's a slightly irregular heartbeat, but you're not suffering from any sort of palpitations or feeling like you're missing a heartbeat or any irregularity, or okay. So the lightheadedness, is that coming on all of a sudden? So are you able to like perform your normal activities and then all of a sudden you start feeling lightheaded, or is it something that's constant? Okay, so your PO2, which means the amount of oxygen that's in your blood. So I'll explain it to you. What happens is we have something called hemoglobin within our blood, and that contains oxygen basically, and that is essential for the oxygen from when we breathe, when we inhale. When we breathe in, we take in, we take in oxygen, and the hemoglobin laps up the oxygen, and that transports oxygen to all of our tissues in our body. So our brain is the most important, yeah? And so that's what we call PO2. It's checking the level of oxygen that we breathe in our body. So if PO2 is low, that means that our brain and our tissues, but most importantly our brain, because we need our brain to navigate life in itself before anything else, it means that our brain is not going to function as effectively as what it would do had we had sufficient abundance of oxygen being taken in every time we inhale, every time we breathe in. Okay, so now we've discussed that, the normal PO2, which is the normal amount of oxygen that attaches to our blood cells every time we take an inhalation or a breath in, is 95% to 100%. In an average healthy adult such as yourself, I'd expect it to be anywhere between 97% to 100%. 95% is fine, depending upon the circumstances. But yours is just slightly below that, and it's 94%, which I'm not too concerned about, because there could be other mitigating factors that have sort of led up to that point today. But it could be a reason why you're feeling lightheaded, okay? And when I did this check, it showed that there's some slight irregularity of the heartbeat. So what I think I'm going to do, based on the irregularity of the heartbeat, the lowish, not low, slightly below average oxygen levels in your blood, and the fact that you're feeling lightheaded, I'm going to get you referred for an echocardiogram, okay? So that's nothing to worry about. Let me just... Okay, so what we're going to do is, have you got any concerns about what I've just said? Okay, so we're going to get you an echocardiogram. We're just going to check your mitral valves, make sure everything's okay. Your blood pressure is a little bit low. I'm not too concerned about that. There is a little bit of an irregular heartbeat. That might be absolutely, I mean, a lot of people in the world have palpitations or irregular heartbeat, so I'm not innately concerned about that. But we are going to get a 48-hour blood pressure monitor on you. We're going to give you a little brochure. You make sure that you write down every single activity that you're doing in that particular time, because we do need to know. And also I'm going to get you referred to which hospital do you prefer to go to? Okay, so we'll try and get that. It's a self-booking system, so you'll get an email and you'll be able to go on to access that email, click on the link, and you need to then put in like your your NHS number and all your details, make sure that's all correct. You can get booked onto the one that you want to go to, okay? So we'll get an echocardiogram sorted for you. We'll get a 48-hour blood pressure monitor sorted for you. And then I think we're good to go. And if there's anything else that you're at all concerned about, you must go and see your doctor. So if the lightheadedness gets worse, you must book an appointment and tell somebody and go and see your doctor, okay? Just make sure that you're taking your insulin at the same time as you're eating something, because obviously what we don't want, you know yourself, that insulin lowers blood sugar levels. What we don't want is you taking insulin and not eating, because you're going to go into hypoglycemia, and that is going to result in dizziness and all that sort of stuff, lightheadedness. Okay, so make sure you're doing everything okay. Hand this into reception and they will sort out your appointments, what I've just said. Okay, all right then, see you later. Thanks, not a problem. Bye, take care, bye. So what that means, again, it's nothing to worry about. All an echocardiogram is where, you know, like when pregnant women go for an ultrasound, and I don't know, I don't want to pry if you've ever had a child, but when pregnant women go for an ultrasound, they have this device that's put onto the tummy with this particular fluid and it looks for the baby. Now then, an echocardiogram is looking at the heart, and it is similar to when pregnant or expecting women go for an ultrasound, I beg your pardon, to look for the baby, to make sure the baby's healthy and things like that. It's a very similar process. What happens is the image on the screen is looking at the heart, and it's specifically looking for the particular valves in the heart. What I am interested to know is whether the aortic or the mitral valve in the heart, I'll go into that in a bit, is failing a little bit, and that could be causing a backflow of blood. That could be causing palpitations. It could be causing, I know you said you're not getting palpitations, but it could be indirectly causing an irregular heartbeat. That can cause dizziness and all that sort of stuff. Okay, so that's what we're going to look at. So what happens during that appointment is you're taken into a cardiovascular, I can't speak today. You're taken into a cardiovascular unit, and that's a unit that specialises in the heart and maybe the breathing as well. It looks at the whole cardiovascular process. People have had heart attacks and that sort of stuff, so it specialises in heart problems. They put you on a bed, you lay on one side. So you know when you go to sleep, oftentimes we sleep on one side, you lay on one side, and then what they do is similar to when you go for your baby ultrasound. When women go for the baby ultrasound, they do exactly that, but looking at the heart. Okay, and it shows on a screen the heart system on an ultrasound image, and they can specifically look at different valves in the heart. The way the valves work in the heart is, imagine it works in the same in the lower legs and the heart. So a valve is something that's closed. Okay, are you getting me so far? Brilliant. So a valve is something that's closed, and what happens is when blood pumps from the heart, and it pumps up to go out and round the body to circulate the oxygen around the body into the brain, what happens is the heart pumps, and it pumps up, and the valve opens and it lets blood through, but then it closes, and it closes in order to stop blood flowing back down, because obviously if that happened, it would cause congestive heart failure. Your heart would get pumped full of blood. Okay, that wouldn't be a good thing, which is not happening with you, so don't panic. So the valve opens, it pumps blood out, and then it closes again, and the blood pumps round the heart, pumps, the valve opens, it pumps blood through, and the whole process goes on and on and on. Okay, sometimes what can happen is in congestive heart, in mitral valve problems. So there's lots of different valves that do that, open and close in the heart. What can happen is sometimes the valve can open and it should close, but sometimes it just doesn't close completely, and so it leaves the area what we call leaky, and so the blood will pump out, and instead of the valve closing completely, it stays open, so just a little bit of the blood comes back through again, and that can cause palpitations and all sorts of different problems, and it can lead indirectly to lightheadedness and stuff like that. So all you need to do is go to the appointment, lie down on your side, and similar to the baby ultrasound, they'll just assess your heart, okay? They'll put a gel around this area here, this area, and they'll just listen and look at your heart, okay, on a screen. So it's nothing to worry about. And you know what, in the vast majority of cases, patients that have got valve problems don't need treatment at all. They just go on with their lives. In the cases where your blood pressure is reducing or you're feeling in patients that blood pressure is reducing, or patients that feel the symptoms are getting worse and worse, there can be different treatment methods for those people. But in 99% of cases, people that present with lightheadedness, with palpitations, they've got valve problems in the heart, such as mitral valve problems, don't require any treatment, okay? So it's nothing to worry about. Okay, I'm just going to have a listen to your heart now, coming back to the heart and palpitations. So just lift your arm up for me. Thank you. And on this side. Okay. And if you can turn around for me. Okay, that's fine. And the last check I want to do, I just want to have a little look in your eyes, if that's okay. Bit of a bright light, so just look straight forward. Do apologise. Okay, great. Okay, so what we're going to do is, have you got any concerns about what I've just said? Okay, so we're going to get you an echocardiogram. We're just going to check your mitral valves, make sure everything's okay. Your blood pressure is a little bit low. I'm not too concerned about that. There is a little bit of an irregular heartbeat. That might be absolutely, I mean, a lot of people in the world have palpitations or irregular heartbeat, so I'm not innately concerned about that. But we are going to get a 48-hour blood pressure monitor on you. We're going to give you a little brochure. You make sure that you write down every single activity that you're doing in that particular time, because we do need to know. And also I'm going to get you referred to which hospital do you prefer to go to? Okay, so we'll try and get that. It's a self-booking system, so you'll get an email and you'll be able to go on to access that email, click on the link, and you need to then put in like your national insurance, your NHS number and all your details, make sure that's all correct. You can get booked onto the one that you want to go to, okay? So we'll get an echocardiogram sorted for you. We'll get a 48-hour blood pressure monitor sorted for you. And then I think we're good to go. And if there's anything else that you're at all concerned about, you must go and see your doctor. So if the lightheadedness gets worse, you must book an appointment and tell somebody and go and see your doctor, okay? Just make sure that you're taking your insulin at the same time as you're eating something, because obviously what we don't want, you know yourself, that insulin lowers blood sugar levels. What we don't want is you taking insulin and not eating, because you're going to go into hypoglycemia, and that is going to result in dizziness and all that sort of stuff, lightheadedness, okay? So make sure you're doing everything okay. Hand this into reception and they will sort out your appointments, what I've just said, okay? All right then, see you later. Thanks, not a problem. Bye, take care, bye.